Hola chicos, vamos a empezar la sesión. De verdad que tener una multiespecialidad, los profesores que hemos tenido el martes, bueno, aparte, el taller fue increíble, todo, la transmisión, la claridad, muy bueno, muchas felicidades a Mariano y al doctor de la Rosa porque fue increíble. Y luego, pues hemos estado con muchas conferencias multidisciplinarias que son fascinantes, pero al final, pues ahora vamos a hacer un poco de urología pura y con quién más que con nuestros grandes amigos, con Mariano González y Pablo Contreras y otro doctor González. O sea, aquí no sabemos si son primos, si son primos. Bueno, el doctor Cesare Scoffone ya lo podemos conectar y le pasamos el micrófono aquí al doctor Mariano González para que lo introduzca y lo salude. Bienvenido, Cesare. Benvenuto. Ciao. Come vai?
One second. So
Ci
thank you very much.
senti? Ci
Yes, yes,
senti?
yes, yes. I can hear you.
Ok, welcome. Benvenuto. A ver, dale,
Pero si tu... Hola Cesare, come stai? Tutto bene?
Very well. Very well.
Bueno,
Little bit tired at the end of the day.
Grazie mille Cesare. Bueno, Cesare Scoffone es el jefe, el primario del Ospedale Cottolengo de Torino, Italia, y ahora va a dar una presentación del equipamiento para la enucleación prostática y cuál es la realidad detrás de lo que es la energía que uno utiliza. Cesare, muchísimas gracias y te escuchamos.
So can you see my slide?
No yet. Yes, now yes.
Okay, can you hear me? Mariano? Mariano, can you hear me?
Yes, yes.
Yes. So first of all, I want to thank Ingrid for the invitation. It's a pity that I'm not coming to Panama, but I think that in the next year would be possible. I think also to join with all these friends involved in this Congress. Thank you also, Mariano and Pablo, for inviting me in the roundtable. Today, I have to speak about what we really need for endoscopic prostatic enucleation. These are my conflict of interest. And I want to start that with a sentence now, because I think the first equipment, as in any surgery, also for enucleation, is the knowledge. Knowledge of the patient, knowledge of the anatomy of the prostate of the patient, knowledge of the surgical technique, knowledge of the armamentarium, knowledge of all the tips and tricks that are fundamental in this surgery. Second, we need for sure a well-trained team. Means that we have to speak with, for example, our anesthetist, because it's fundamental that the patient is stopped during the surgery and maintain the same blood pressure that he has normally. So, because this is very important in order to check the bleeding at the end of the surgery. And one very important role as the scrub nurse. Scrub nurse has to check all the armamentarium before starting and seeing that you have every single detailed piece of your instrument for enucleation, but especially for the morcellation. It's fundamental to have a good morcellator, and this has to mount correctly the morcellator and checking all the different pieces and also the aspiration of the morcellator during the surgery. And they have to also to check everything, the irrigation, the right aspiration for the morcellation, the efficiency of the different foot petal means that they have to control the foot petal for the laser, the bipolar, for the morcellator, and also to check the temperature of the patient. It's very important to work with warm water, not around 25 degrees, 30, 35 degrees, in order not having the problem of freezing the patient. No, having this problem that you can have, especially if you have a prolonged surgery. Okay, so this is very important. And we have different steps. First step is the OR organization. I think that it's fundamental for each surgeon to put the different devices, the tower, the laser, the aspiration, the irrigation, and in the same place, and sharing with the scrub nurses this and maintaining a systematic way to do this. This is really fundamental to have every time in the same place the different devices. Regarding the operating table, it's very important the draping. We have the funnel system that is really efficient in terms of avoiding the spreading of all the irrigation around. And also it's very important to have the table in the right position, your chair in the right position also, in order to have an ergonomic position, avoiding back pain or pain in the cervical column, and so and so. For the irrigation, it's very important to have a warmer, and for the irrigation is also very important to have the possibility to increase. We don't use usually any pump for emulsionation, but we have the possibility to increase the height of our irrigation bags. 30-40 centimeter is the usual height during the enucleation, and if you need, for example, for some bleeding, you can increase 20 or 30 centimeter. But what is very important is to have this possibility during the morcellation in order to have a very good irrigation inflow to maintain the bladder completely full during all the morcellation. What is very important also for doing enucleation is to arrive in the prostate, and this you need sometimes, especially due to the fact that we are using now prevalently this 26-24 Charrier instrument to have in the OR the agar dilators, the possibility to do a meatoplastic or after the meatotomy. If you reach one section of the urethra, you have to be able to open. My favorite method is with the laser in the last 4 years. But if you are not confident with this surgery, you can use the Sachs ureterotomy, and is very important at the end to do everything in order to respect the anatomy of the patient. And regarding the standard working element for the laser, I prefer this tapered tip. In my opinion, it's very important to have your laser fiber stopped during the enucleation, and you have to know that this working channel in this part is fitting the 1000 micrometer fiber. Usually we are using the 550 micrometer fiber, and we need this tapered tip that you can see here. And the one really good evolution of instrumentation was done by our friend Felipe Figueiredo from Brazil, that invented this mini receptoscope and instrument for laser energy with two different diameters. I think that 22 Sharia is the bigger and also the more efficient, because with this instrument you can do enucleation and also the morcelation with this morcescope. And you have also the possibility to have this 18.5 Sharia that is also fine for enucleation, or for enucleation, for example, of the middle lobe, for incision of the bladder neck. You can use this really miniaturized instrument without the needing to the needing of inserting big instrument. And this instrument for sure create less risk of urethral strictures. What is also very important is to find and to choose the right optic. In my daily practice, I am using since 26 years the 12 degrees optic, but you can do this also with the 30. I think that with the 0 degrees is not really helpful for because is sometimes difficult to hello. Hello? Hello?
Cesare,
Can you hear?
we are
Yes?
hearing you. Yes, yes.
Yes, can you hear me now?
Yes,
Again?
yes.
Okay, because I lose the audio of my voice, no, because I have my voice, but now it's fine. Okay, so I'm using this 12 degrees optic. I think that 0 degrees is not the right optic for enucleation. Is the 30 degrees you can also use, but when you start to use one optic, is important to have always the same optic in order to have the same field of vision to adapt your movement to your vision. The fiber that we are using is 550 micrometers, and I don't use the aiming beam because it can cause some disturb on the vision due to the overlighting of this laser beam. And we are normally using now the reusable fibers for the problem of the cost. And I have also always in my on my scrub nurse table the bipolar to use at the end 2, 3, 4 minutes in order to coagulate some vessel that is impossible to coagulate with the laser, to check the orifices, to check the sphincter, to remove some clothes and finish in the right way the procedure. One important step of the enucleation is for sure the morcellation, and is very important to have a very good morcellator. It's very important to write on the blades that you are using the time that you use, and we define these life blades time in between 90 and 110 minutes. And we are using this till 2200 rounds per minute. And now with the new foot pedal of the morcellator of Karl Storz, we can modulate the speed of the blades during the surgery. At the end, we need a catheter. This is the standard catheter that we put normally in the bladder with the balloon into the bladder with a gauze that we can maintain this for 2-3 hours after the surgery for the venous bleeding. What is also very important and to know that this cover for the camera sometimes are warming and are created some fog. What is really useful is to use the warmer that normally we are using for the patient for putting this warm air into the plastic cover of the camera to try to remove this fog effect that you have on the camera. In any case, for any surgery is sometimes there are difficulties, there are others, and also in enucleation we have this kind of problem, but I think that with a good team and especially with a very good knowledge, we can overpass this problem altogether. And at the end, I would like to invite you all next TNT, the 16th edition of the TNT. And okay, I'm sorry, they put the wrong save the date. This year is in October 27, 29, 2026. So thank you very much for your attention.
Una
Muy bien.